This podcast is brought to you by Penji. Penji is a creative subscription service that gives you access to pre-vetted, agency-trained creatives from all over the world. From graphic design to illustrations to social media management and web development, it's all included for one monthly price. It's time to say goodbye to the hassle of searching for top-notch creative talent. With Penji, you get quality and consistency delivered right to your inbox every day, carefully crafted for you by humans. So meet your new creative team today. Head over to penji.co for more and enter the coupon code located within the podcast show notes.
All right, everybody, welcome to the Fully Managed Podcast. You know what this podcast is about. We talk about business, we talk about marketing, and we give you guys tips and assist you in your business journeys. I'm your host, Penji's Partnership Coordinator. My name is Daniela, and today we have a really special guest, Johannes. I actually don't know how to pronounce her name. Johannes?
Johannes is very correct.
Johannes Kraus from Youth Health Group. Hi, Johannes. How are you? It's so great to have you today on the podcast.
Hi, thanks for being on the show. My name is Johannes, co-founder of Youth Health Tech. I'm very happy to talk to you today.
I'm super happy to talk to you today. But to kind of break the ice a little bit and get the ball rolling, I have a little bit of a fun question for you. Not about business, but if you were to meet a child from the 1800s and you had to explain to him what a meme is, what would you do? How would you explain that?
Oh, that's a great question. So because I think it's very difficult to explain things which are not there. So I don't know. I think storytelling was always there. Was there in the past, will be there in the future. Now we do this with funny pictures, and I think we could just explain it. Hey, there is a new form of drawings, is very sharp and very nice, and you can have the most funny drawings ever in your life just by a click. So that's how I would try to explain technology to them. And I think humor or fun, like memes, were always been part of society, even 200 years ago.
Yeah. I think I would just be like, it's a joke from the modern world. It's the word for joke in the 2000s. I don't know what else I could say.
Yeah.
Thank you so much, Johannes, for that. So now to actually get a little bit more into business, can you tell us all about yourself and everything that we need to know to kind of get everybody introduced to anybody who's not familiar with what you do, what you guys do at Youth Health Group? Yeah, where's yours?
Yes. So maybe I start with myself and then I go a bit into the company. So I'm one of the co-founders of Youth. I have a background as a physical therapist and in management and technology. So actually a mixed background. I studied physical therapy in the Netherlands, which was a very exciting time because they are much more ahead in this preventative health space. And when I worked then in the healthcare system in Europe, I realized, okay, we are not so much ahead. We are pretty looking backward, treating diseases, do not think about prevention, spend all our time and money on treating those diseases which should not even be there. So that really annoyed me. And I thought, okay, I want to change that. And I have the strong belief that how you can change society is in offering them very cool products. So I don't know, before there was booking on an Airbnb, everyone was booking the hotels via a phone and it was complicated and there was barrier. And now you have everything in an app and everyone uses it because it's a cool product. So I think we can change healthcare in the same way by offering cool products. To achieve that, I thought, okay, I need maybe a bit more business knowledge to build it, and joined Technical University of Munich, where I studied management and technology on top of that, and then gathered experience in insurtechs and innovation departments of insurance companies, always to make this healthcare much more easier, much more accessible, much more fun. And at one point I thought, okay, now I've learned enough. I found my own company. And that's where I met my co-founder, Filippo, which was working on the same problem. We will come to the problem in a second. And we joined forces and founded Youth Health Tech. Exactly.
That's so, to me, what's so interesting is that you started as an actual person who was working in healthcare and transitioned into being a business owner. Um, was that a difficult, I mean, you mentioned going to the University of Munich for it, which obviously must have helped, but I feel like it must have been a difficult um, transition from, I'm assuming, working with a patient directly or, like actually being in the field towards being in the business and what that entails, right?
100%. So it's actually pretty rare because the people who work in healthcare, they work there for a reason. They usually like people and they like to work with people, hands-on, help them. They have this, I want to take care. And there are not many which say, oh, I want to become an entrepreneur. Oh, I want to become uh, want to build a business out of that. And business is more numbers driven and uh, not so much with the people. So this is kind of rare, and the transition out of that was hard. So I needed to go to university where everyone is then again, oh, I want to build a business. Technical University of Munich is very entrepreneurial, so to get in the crowd of those people was very important for me to get out of the healthcare system and start my own business. Yes.
Did you feel like you had to sacrifice the patient work, like that side of it to be in a business, or did it feel relatively easy? Because I'm curious about how that felt.
For me, it felt relatively easy because I still have the feeling I'm helping them. Just the way I'm helping them is different. Before I helped them mainly with my hand, now I'm helping them with products. So I think that's the main change, but still I have the feeling I'm helping them and I do not have the feeling I sacrificed.
So I also am curious because I feel like, with healthcare, you go into this sort of slippery slope of how much it changes, depending on where you are, like laws in different countries are different, resources in different countries, what they prioritize. And I think some countries are more advanced in the medical field than others. And then within the medical field, there's so many different branches. Um, how have you been able to adapt to all of this when it comes to youth healthcare? Because I feel like like the way that the healthcare system is in Germany is very different than the Netherlands versus England. Then you go to Asian countries, it's different. Then you move to the US, it's completely different. And I feel like it must be difficult to sort of try to make something that, work for everybody, if that makes sense.
Yeah, it makes a lot of sense. For me, this has two pillars. So one is what is kind of similar around the world is the user. And for us, the user is always in the center. And we want to offer the user a better health experience. We want to make preventative screenings and health accessible for them, that they feel in control. They can easily do that. And this is what we want to achieve in any of the countries. Um, and so this is the part where it doesn't really change because we want to create this very nice user experience here. Where it changes a bit is in terms of regulation. And regulation in healthcare is a big problem because it's a big thing and a big blocker for a lot of technology. We have decided to go as a wellness device first. So for us, the main point is it needs to be accessible and fast. Yes, it is very accurate, but it does not have to be a medical device for us now. So that's why we started like that. And this reduces the regulatory burden a lot because you can be there much more easily.
That's super interesting. And actually, what I thought was really interesting about your product is how much it emphasizes like user friendly. It's very much like focused towards being usable for the person that's going to be using this and having to follow that sort of action. Um, Do you think that all of this was influenced by your education and your background within the healthcare system, or has it been sort of an adaptation to what you think are the needs currently, or a mix of both?
Mhm. So I think it comes purely from the background of the co-founders. So Filippo came with the initial idea. We should maybe pitch the idea in a second that everyone knows what we're talking about. But Filippo came with the idea that, okay, smartphone-based health screenings is is a big thing, because he was annoyed by, okay, I'm going to so many doctors, it's so fragmented. I want to have this easier. I want to have this for me in one place. So this is where he was coming from and had the idea. And I was thinking in the same direction, because I had all these patients I had in physical therapy, and they were always coming to me and say, Johannes, can you heal my low back pain? Can you make my knee better? And I was always like, sorry, if you would have started a bit training, exercising your back muscles 6 months ago, you would have not have this problem now. Or if you would eat more healthy, then you would have not been in adiposis status right now. So I was, sorry to say that, but I was a bit annoyed of those patients, because I thought, hey, you can do so much better and we are not taking this chance. So we need to make this easier. And so we were both coming from the problem, and that's that what led us into this solution.
I love that you had such real world experiences with that, because I feel like that's when you feel like you have a more broad business owner, I think, is when they have actually recognized something and put it into an actionable thing or item. Because I feel like a lot of businesses fail nowadays, and I think a lot of them fail because they're kind of just not addressing any pain points, right? And I usually, when I talk to business owners who say like, "Oh, I had a struggling business," it's usually because they start things that are, like, "Okay, but why did you need this? What was the problem that this was solving?" Like, so I love that, like, your whole story is, just like noticing it firsthand and experience, and then moving on to figuring out a solution for that problem. Um, and for everybody who's not familiar with the product, what we're talking about, do you want to tell us a little bit about it? Give us a rundown for people who are kind of like, what's going on here?
Yeah, of course, of course. So our company is called Youth, and we are building at the moment an application for smartphone-based health screenings. You can do a full health checkup in just 2 minutes, only from your phone. So as said, we were coming from the problem that prevention is not accessible, and we are on a big mission to extend healthy lifespan by making this prevention accessible. So how does this work with the smartphone? You just take your phone and you take a face video. So you look into the camera for 30 to 50 seconds. Then you do an audio recording where you talk about your day or your last holiday very freely. And then you do pictures of your eyes and of your skin in the face. Um, and with only that data inputs, we can screen for 7 health areas and more than 50 biomarkers. So you don't need a wearable, no Apple Watch, no Whoop, no whatever. You don't need a blood test or to go anywhere. Just with that, we can screen those biomarkers, detect risk, can tell you where you should optimize and what are your main problem areas and where you can improve. And that's basically what we are building. As a business, we are positioning this as an entry point for all health and wellness services. Because you can imagine, everything starts with a screening. You screen and it tells you, your heart health is not the best. And at that point, the user have the feeling, oh, I need to do something about my heart, but what can I do? And here our integrations and partnering comes into play, because we will give some recommendations, but we can also say, hey, here is a good course for you, cardio course you can do. Here is a nice supplement product you can buy. This is what is offered by your insurance company with that problem. So everything starts with that screening is the access point, and then we continue to our recommendations and other businesses.
Do you think that, because obviously, like, you're doing a screen with the phone, for people who have the concern that it might not be as efficient or as honest as, for example, a blood test or like a urine test or what is traditionally used in modern medicine to do a lot of these. Um, have you guys been able to have like the research and the guarantees to make sure that, like it's going to give you the same kind of results for certain things? I mean, I assume that it's a process, right? But, I also wonder if this is a question that I get. I'm assuming that you guys get a lot.
Of course, and is a very important one. So for us as a company, it's very important that we are trusted. The moment we lose the trust or people think, these results are sketchy, they will stop using our product. And this is not what we can afford. So for us, only algorithms go in the product above a certain threshold of of accuracy, which is depends a bit on the biomarker, but as a ballpark, you can say all over 90% accuracy. And we all compare that with the gold standard in medicine. So it might be a blood test, it might be an ECG, it might be an doctor assessment. So it's very important that we are there. But there's another point to it. Because you asked me about the blood test. So we are very accessible. A blood test might have some more biomarkers and might be in some regions a bit more accurate, in some not. But for the blood test, you either need to go there, get the blood done, get home, wait a week for the result. They come in PDF format, which you cannot put into your phone. So it's not accessible. Now there are some more home tests. Still, you need to be at home when the test gets there. Otherwise, the postman takes it away again. You need to do it yourself, which is very painful and you don't like it. Then you need to send it. So everything is cumbersome. We want to make prevention and health accessible. So that's why we just put it on the phone. And that's a bit the trade-off where we have, okay, maybe we go 1-2% points lower in accuracy or have some less biomarkers, but you can do it from your phone at home whenever you want. That's the where we play.
That's so yeah, I mean, I think blood tests are also very, like, in where I live, for example, you have to I think they're relatively affordable, but depending on what like, for example, you get blood work done initially for one thing, and then it comes out that you were, like, anemic or, you have some kind of iron deficiency, I don't know, whatever it comes up, and they start asking for more tests, it continually, like, it gradually keeps getting more and more expensive. And I think a big concern, like you said, was also just, like, having to wait so long for a result, when you are sick, right? Like, your body's still sick while you're trying to figure out just what that disease is. So I definitely think that something like that can I mean, the quickness of it is probably the most important aspect. Yeah.
Yeah.
Yeah, because like, I feel like that's just kinda like you've mentioned, like, testing and I know that in America, it's really expensive, any kind of medical, procedure unless you have, like, a good insurance. And I which actually I mean, even though I think it's like a great technology, but what I wonder is how were you guys actually able to develop that? Because I feel like it would probably would require research and, a lot of, like, stuff to go into it so that you can do these type of screening.
Yes. Great question. So we have a mix, what we call internally a mixed model approach. When we looked into that problem, we've seen that there are some smartphone-based health screenings outside on the market already. And we have realized, okay, there are some white spaces where in certain health areas, there is no algorithms available. So what we have done is we take the existing, very validated, very good market and clinically approved algorithms and aggregate them into one platform. This has the benefit that we don't do all the heavy lifting in terms of data collection and reproducing algorithms which are already there. No, we make use of what is already on the market and bring it together. those providers usually focus on one technology or on one health area. So they, for example, only do heart checks or only do brain checks via voice. And we in our platform combine this different data inputs with voice, video, pictures, typing patterns, walking patterns, and so on, and combine all those checks into one application as a big aggregate. That is the first part. And the second part is the white spaces where we haven't seen any good algorithms on the market. This is what we build ourselves. Here, the main challenge is the data collection, because to collect this, what we call multi-model AI data, so data for the same use case, but different data inputs, to collect that is not easy. And we are working with research institutions on that. And you need a lot of data to get up the accuracy. And we are doing this for some specific areas where we don't find anything on the market, to really have this holistic screening.
That's so I think interesting. I know not a lot of education on healthcare, so I think it's really interesting to always talk to someone who knows so much about it. Um, in terms of the financial aspect of it, how do you actually make this as something that's going to be? Because I mean your whole idea is targeted towards the general public, right? Which means that you have to prioritize for it to be accessible to the run of the mill mom and your normal blue collar worker. How do you work around building a business model that is going to be affordable? Because I feel like whenever we come up with new technologies like this, it's always expensive at first, and then it slowly starts to get more and more affordable. Kind of like with, you remember the iPhone came out, every time there's a new iPhone, it's $1,000 whatever dollars, and then as it gets older, it's it gets cheaper. So I'm curious as to how you have been able to sort of navigate this with your whole idea.
Yeah. We were now talking a lot about the product, and you've perceived correctly that we are thinking about the end user, because health, prevention, and ultimately health should be in our opinion, in the hand of the end user. So we want our app to be distributed to everyone, everywhere. That's our big goal. Make prevention accessible for 8 billion people. But now let's talk business. So to achieve that, that's not easy. And we have seen that B2C models in health and wellness are very expensive to scale. I don't know if you are aware, for example, of the mental apps like Headspace and Calm, two big
Yeah.
brands. And
Yeah.
in their history, they needed to raise a lot of money just to build those brands and to acquire those users, because their customer acquisition costs are crazy high for their lifetime value. So it's very, very, very small margin business models. So we have, after realizing that, we have not chosen this path to go directly to B2C. We go step by step. And our first step is to go in a B2B2C model. So we have our application and we co-label this with big distribution partners. We started with a very small niche with our early adopters, which are longevity clinics. It's not a lot of people. It's not accessible for everyone in the broader mass, but it was a nice start for us to build the product and to get business revenue, because basically the clinics are paying us and giving it to their users for free. Now we are moving into bigger companies. So we have our first client in the insurance space, for example. So we can create a healthier insured people mass for them. So they have an interest in healthy users, because then they spend less. So they pay us for the app and distribute it for free to their end users. And now it gets already in a broader mass. When this business is established and rolling, we will open this obviously to the public And what we also can see as an ultimate step is to even work with governments, make it very inexpensive to target regions, for example, I don't know, India, Africa regions, with a very low price point, but make healthcare and prevention also accessible there. So that's basically the path we are going, and that's the current point where we are standing in a B2B2C business model, co-branding this with insurance and big companies to get it to the masses.
Does the insurance and all of that part of it play any part in what you guys are doing, or is it something that has no effect in it at all?
No, I think it plays a part, but not in a negative way, in a positive way. So whenever you say insurance, the people are, oh, I don't want to know that the insurance has my data and so on. So I
Yeah.
think this is something we are making sure, and we are communicating that your data is with us, and your insurance will not punish you if you don't live healthy. So this is because this is illegal and not possible. Obviously, they have some interest in their data. So, for example, if they realize, I don't know, in central London, there are all the women between 30 and 35 have one specific disease more than everyone else everywhere else in the country, then they can act on that and can build initiatives to get those people healthier. So this is how we interact with them, but never on a individual basis. And I think where the insurances want to go is to become more seen as health partners. Because today, when do you interact with your insurance? When you have a problem, when you have a claim, then you fight with them that they pay more. That's usually the interaction you have with insurance. Not the coolest engagement, to be honest. So where they want to go is they want to be perceived more as, hey, I'm your partner to help you to stay healthy. We support you with that financially. We have some product offerings for you. We can guide you on that. That's our competence we also have, not only the financial backing. And this is the development they're doing. And obviously we are playing a good role in that because we are helping that to do that.
I totally understand. Like, I feel like the word insurance just scares people into thinking that something bad is happening. I think especially in countries where people don't have access to like public health care, it's probably where they were like a little bit more like, ugh, the most. Um, but I love that you guys are, like mindful of that reality and how much it changes for everybody else. And Jo Johan Johannes, I
Johannes,
think.
yeah.
Yeah, I got it. I got it. It's been so great to have you on the podcast today. We are running out of time, but I want to give you the space to promote anything. If what we spoke about today resonated with anyone, they want to talk to you, they want to get to know you, they want to work with you. Floor is yours.
Yeah. So there are multiple options, of course, to interact with us. And so I think we are always looking for good talent on the tech side. Of course, whoever wants to build cutting edge technology is right with us. And we are a very hyped team. So we work hard. Because we are in this mission together. So whenever you want to push on the business side, feel free to shoot me a message, and we can see if there's a position or for an internship or for a full-time position for you. I think that's one very important point. And for all the healthcare partners in your podcast, also feel free to reach out to me if you want to learn more about the technology. I strongly encourage you to be more bold and believe in technology, because we all know it is the future and there's so much possible and we can optimize healthcare so much. So be bold, try to explore those new technologies, and I'm happy to talk you through. And yes, then to all users, so support us on our journey. And yeah, I'm happy to be on that podcast. Super nice.
It's super nice to have you too. I will be adding the links to description of this video so that people can access them. They can see them easily. Thank you so much, Johannes, for being here today.
Thank you. It was nice.
Guys, I will see you on the next episode. Like, subscribe, follow, listen, do the whole shebang. Thank you so much.
You've been listening to Fully Managed, brought to you by Penji. Check out the show notes to learn more about today's guest, and to learn more about Penji, the human-first creative subscription service, head over to penji.co. And by the way, if you're still listening, it would mean the absolute world to us if you were to share this podcast with a friend, and of course, subscribe.